Welcome everyone to today's session of Managing Your Finances During Cancer, led by Rick Fingerman. Today, Rick will be discussing Medicare, Medicaid, and Social Security FAQs. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Rick for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a brief Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Rick.
Thanks, Becca. So this is another series of our How to Manage Finances During Cancer Treatment. And as we mentioned, it's Medicare, Medicaid, and Social Security. We could actually do, a 5-hour webinar just on each one of those topics. So these are just questions that have come in more recently that we thought we would share. And if you have any questions, we can try to address those as well. So Medicare, Medicaid, and Social Security. So this is just a quick little slide. That's me in the middle holding that little trophy. At the time, I think was president of the Financial Planning Association of Massachusetts, who partnered with Dana-Farber back in 2008. And this is a check that we had won for some type of initiative from the Foundation of Financial Planning. And we donated this to the Patient Assistance Fund. So that was back in 2011. Wow, time flies. Quick little disclaimer, this presentation is strictly educational, not to be legal, tax, or investment advice in any form or fashion. If you have any questions, Medicare or Social Security and Medicaid is very complex. So it's always best to seek advice if you're going through that process. So let's talk about Medicare first. So the first question that we have got is, do I need to be on Social Security to enroll in Medicare? And the answer is, no, you do not. They are two separate entities. You can be on both at the same time. If you're eligible for Medicare, the earliest one can apply is 3 months before they turn 65. That's the ideal time to actually apply if you're going on Medicare, because it takes a little time. And this way you can kind of hit the ground running when you're 65. However, if you have been on Social Security disability for at least 24 months, or you have end-stage renal disease, or you've been diagnosed with ALS, you're also eligible for Medicare before 65 as well. And Social Security, we'll talk more about that later, but that can generally begin as early as 62 and as late as age 70. And we'll talk more about that later. Question 2, I was told I am better off applying for a Medicare Advantage plan instead of enrolling in original Medicare because it's cheaper, covers dental and vision care. Are there any downsides to Medicare Advantage plans? This could be a whole seminar. As a matter of fact, I'll talk to Becca after this. If this seems like a topic of interest, I have a specialist that is nationally known that we can do a great presentation on the different options of Medicare Original and Medicare Advantage plans. So Medicare consists of 2 parts. This is just kind of a little background. There's Part A, which is free. That covers the hospital costs. And there's Part B, which covers the doctors and some other type of costs. This is true whether you enroll in Original Medicare or you opt for a Medicare Advantage plan. If you do go the original Medicare route, it is smart to also get a Medigap policy. Some people call those Medicare supplement policies, because that's going to help cover the costs that aren't really covered by original Medicare. You would also need a Part D prescription plan to cover your prescriptions. But if you went the Medicare Advantage route, you don't have to worry about that because that Medicare Advantage plan includes generally the prescriptions, some dental sometimes, and also eye care, things like that. People tend to lean towards those Advantage plans. You might see them advertised on TV all the time, or they send you stuff in the mail. But remember that simpler isn't always better. If you're approaching 65 or feel like you need to get on Medicare, it really makes a lot of sense to look very carefully at this. And there's many reasons why. So again, I said Medicare is confusing. And also each state can have their own rules around Medicare. Massachusetts, for example, has a slightly different open enrollment period of when you can apply for a plan or change plans. In most states, once you're on a Medicare Advantage plan, if you switched from an original Medicare plan, for an example, and you want to go back to original Medicare, you may not be able to do that if your health has changed because there's medical underwriting in those cases, and they might not take you. In Massachusetts, you can switch back to original Medicare from a Medicare Advantage plan during open enrollment. So, and you don't have to have any insurability issues. So there are some advantages. There's 3 states that actually allow that. So depending where you live, you might be able to switch back and forth, but you might not be able to. So you really want to look before you leap. Doctors outside your network, if you're in a Medicare Advantage plan, aren't required to take you up as a patient if you're not in if you're in a Medicare Advantage plan or not in the right Medicare Advantage plan. And why is that important? Well, if let's say you live in Ohio and you want to see a specialist at Dana-Farber or Sloan Kettering, you might not be able to do that because you'd be considered out of network and your plan wouldn't cover it. But if you had original Medicare, you don't have that issue. You could live in Ohio, come to Dana-Farber and get world-class treatment, not a problem at all. So bear that in mind. Question 3, I was told I should apply for Medicaid. How does that differ from Medicare and which is better? I get this question a lot because people use those 2 terms interchangeably, Medicare, Medicaid. They sound alike, but they are very different. They're both government-sponsored programs in the US, but they serve different people. Medicare is basically for, again, if you're approaching 65, you paid into the system, you're eligible for Medicare to go on that for healthcare. Medicaid, it's known as Mass Health. If you live in Massachusetts, you have to have income below a certain level, and it's based on family size. The more kids you have, the higher your income can be, but it's definitely a needs-based program that's based on income. And unlike Medicare, you can be on Medicaid and you can lose your eligibility if your income changes. And that's all well and good if you're, let's say, having treatment at Dana-Farber because you've been out of work for 2 years and you can't work. It's great. Apply for Medicaid. That helps out. You can get your healthcare costs taken care of. But then let's just say you go back to work. Now your income might have bumped up. And that's all fine if you're making a lot of money, but people can have gotten bumped off Medicaid for just small amounts of increase. So you have to be careful with that. We'll look into that. Number 4, what's the best age to apply to Social Security? This is probably one of the biggest questions I've gotten over the last 30 years of helping people with their finances. And because it all depends. Oh, here we go. It depends. I don't like to give that answer, it depends, but it's true. As I mentioned earlier, you can generally collect Social Security as early as 62, or you can wait as long as 70. If you collect at 62, though, you'll permanently reduce your benefit compared to waiting to your full retirement age. And your full retirement age is different for most people. If you're born in 1960 or later, then your full retirement age is 67. But let's say you're born in 1958, it might be 66 and 8 months, for an example. But for the sake of argument, let's just call it 67 or round it up for people that are born from 1960 on. You can collect as early as 62, but if you're still working and you're making more than around $14,000, Social Security can hold back benefit if you're still working, making more than that, if you apply for Social Security before your full retirement age, whether that's 66 and 8 months or 67 or whatever that might be. If you wait till age 70, your benefit grows about 8% a year from your full retirement age to age 70. So for someone that doesn't need the money, has a long life expectancy, it could make sense to wait longer than your full retirement age. But getting back to that earnings test, once you hit your full retirement age, you can make $1 million a year, your benefit is not reduced. Also, if you're married, when you collect could affect your spouse's benefit. So you have to be kind of careful if you're in a married situation, you kind of have to look at both people. If you're widowed, there are special rules on collecting that can increase your overall benefit. So you want to consider that. Also consider life expectancy before collecting. Again, if you feel you're going to live a long time, like well into your 90s, waiting until 70 can make a lot of sense because again, you get that buildup of 8% a year by waiting, and then you're getting a much bigger check from 70 all the way until you pass away. If you were married, excuse me, and divorced more than once, you may be able to choose which ex-spouse to collect a benefit on if their benefit's higher than yours. So years ago, I had a woman, she was married 3 times. if you're married at least 10 years. But she was married to all three of these people for at least 10 years, and we picked the highest earner was the one we collected on. So it was kind of interesting. Question 5, do I need to pay taxes on Social Security? This is another big one, I guess, that people say, well, I don't have to pay taxes because that came out of my paycheck. It was like a tax. Well, you might have to pay tax. So it depends. Social Security benefits can be taxed up to 85%. So here's an example. If you're filing your taxes single, not married, and your combined income, which we'll talk about in a second, is between 25,000 and 34,000, you may have to pay up to 50% of your benefit. So the way they calculate this combined income is they take your adjusted gross income. So that's how much you've earned from working, let's say, maybe some dividends, and then we subtract out some credits and things like that. They add in any non-taxable interest, and that's really interest from, let's say, a municipal bond, for example. So you don't pay taxes on that interest, but they use that interest to figure out this calculation to see how much of your Social Security benefit they're going to tax. And then they add in half of your Social Security benefit. And when they come up with that number, it determines like how much tax you might have to pay on your Social Security. So not ideal. Question 6, if my spouse dies, do I get the benefit as well as my Social Security benefit? And I get this a lot too. People think, well, when my spouse passes away, I'll get my 2,500 plus the 3,500 they were getting. Sorry to say that it is not the case. You get one or the other, whichever one is higher. So for an example, you're married, you're getting 2,500 bucks, your spouse is getting 3,500, they pass away, you're going to start getting 3,500. Your 2,500 goes away. You don't get both, unfortunately. So I think we're coming to the end here. Question 7. My ex-spouse is remarried. I was told I can't collect a benefit on their record. So that is actually not true. If you were married for at least 10 years before you got divorced, you, along with the new spouse and even another ex-spouse, could collect on their record. And your ex-spouse doesn't have to know that you're collecting on their record. You do need some information. This is something you can't apply for online. On your own personal Social Security, you can log on to ssa.gov and apply for a benefit for either disability or for retirement. But when it comes to collecting on an ex-spouse or a deceased spouse, you actually have to go in person and deal with that. But again, if you're married for 10 years and you're divorced, you're entitled to a benefit. The way that works is you generally get, if you collect, again, depends when you start, but if you start collecting at your full retirement age on your ex-spouse, you're going to get 50% of their full retirement age benefit. If they pass away, even if you've already been collecting, you'll get bumped up to what they were getting when they passed away. So there are some unique situations when it comes to ex-spouses, deceased spouses, and things like that. Here's just a quick resource list. This is the Social Security site that I recommend everybody, regardless of your age, to go on to ssa.gov and establish an online, it's called My Social Security account. I've done it, and I always say if I can do it, anybody can do it. It doesn't take long. You enter some information in, and what that allows you to do is to see what your benefit will be when you're at your full retirement age, at age 62 or at age 70. Let you see what your benefit would be if you were disabled. It lets you see what your family benefit would be, because your family's entitled to a benefit as well. So here's an example. I was working with a Dana-Farber patient years ago. He passed away, unfortunately, in his 50s, and he had 3 children and a spouse. The spouse was well under 62. She was like in her late 40s. The kids were all under 18, which means that they are eligible for a Social Security benefit. The wife was also eligible as a spouse, even though she was under 65, because again, there are some different rules with widows. But we did the numbers and realized it made sense for the kids to collect Social Security on the dad. It didn't make sense for her to collect because she was still working. So whether it's your own income or an ex-spouse or a deceased spouse, that earnings test applies. And if you're making more than that $14,000 a year and you're under your full retirement age, then your benefit is going to get reduced. So we just had the 3 kids collect. Money went into their accounts that was used for college later on. They're all actually in college now, which is great. So there are a lot of things to consider, and you have to look at all the details. But definitely, log on to that ssa.gov, establish an account, not hard to do, and you get a lot of information. Medicare, this is something that you can access it through the ssa.gov, but you can also go to medicare.gov and you can actually go through and look at Medicare plans. We talked about there's the Medigap plans or the supplement plans, and there's also the Part D prescription plans. You won't see any Advantage plans, I don't think, part of this. Those are all sold by insurance companies directly. They're really not government plans, even though they have the word Medicare in them. It's a little deceiving. So you want to be careful with that. And then Mass Health, if you've been out of work or your income is low, there's a ton of benefits you can get from Mass Health, whether it's health insurance, might be food stamps or other types of services, which is great. So you want to look into that as well. What else do we have here? And this is just my offer to everybody. If you want to chat, you can give me a call. We can talk about your personal situation, and I can direct you to get answers if I don't have them. Also, if you are a patient of Dana-Farber or a family member is a patient, you are eligible for the Pro Bono Financial Coaching Program. That's what I mentioned early on that we won that award for. Totally free, no cost to you. You'll be matched up with a certified financial planner that has been trained in these areas of Medicare, Social Security, debt, estate planning, all kinds of stuff. We'll match you up with somebody. You'll get the help you need. But if you want to talk to me personally, email is generally best, because then I can send you a link to my calendar and we can set up a quick 15-minute call and I can help answer any questions you might have. And I think that is it. Yep.
Great. Thank you so much, Rick. As always,
Sure.
it's really helpful. We do have a question in the chat, and I believe this question was asked when we were at question 4, and I can always pull that slide back up too. But the question is, what if you are unmarried?
Yep. What's the best age? Well, if you're single, it still depends. So if you've paid in enough money into Social Security to be eligible for a retirement, and this is for retirement, I'm thinking they're talking about, you can apply as early as 62 or wait till 70. It kind of, depends on when you need the money as well. I have a client that I worked with that at 62, we had to start. She had no other choice. She had no other means of income. She didn't really have much in assets. She had to apply at 62. So if somebody has other assets, they've got a lot of savings or retirement accounts, and they're pretty healthy, it could make sense to wait a bit, at least till that full retirement age, if you're working, because of that earnings test. Once you, again, hit that $14,000, whatever that number is this year, then your benefit does get reduced. So I don't know if that answered the question. If it didn't, feel free to stick something else in the chat.
All right. And then another question. My spouse is pretty ill and on Medicare. I have power of attorney. Will this allow me to ask questions on his behalf?
That's a great question, actually, because a power of attorney, just to give you an idea what that is, it gives someone else the right to manage your affairs if you're not able to. So they could do things like, file taxes or pay bills or even access your accounts or sell or refinance a property. But Medicare has their own form. So if you really want to get information, you need to fill this form out. If somebody is interested in that, just shoot me an email and I'll send you a link to that form. You fill it out, the person signs it, you send it back, and it can be revoked too. So if that person changes their mind and doesn't want you to do that anymore, they can do that as well. But that's a good question, and it's not a bad question and a bad thing to have. I'm telling more clients about those now that are older that have 6 spouses, because if you need to find something out, you're not going to be able to, and you'll be kind of in the dark.
Great, thank you. And keep these questions coming. We have another one. My social security benefit seems low based on the number of years I worked. Is there a way to see if this is accurate?
So whether you're collecting or you're not collecting, when you log on to that ssa.gov site and you go to My Social Security and establish an account, not only will you see what you're going to get at 62, at 67, your full retirement age or whatever it might be, and 70, but you'll also, there's a page that has your earnings history. So it goes way back. I've looked like in 1978 or whatever, I made like, $85 or something on mine. I had some part-time job, I'm guessing, or whatever, I don't know. But you should see that. If you see gaps where there's some years where there's nothing, that could be normal, because you might have been out of the workforce to raise a family, for example, or been in school. But if you said, hey, I worked in, 1992, 93, and it says I made $48, something's wrong. So you can challenge that by going back and letting Social Security know what your earnings were. You generally need to get either an old tax return or some kind of tax documentation to show that, but it can be done. And it's important because the higher the numbers you have in that work history, the bigger the paycheck you're gonna get from Social Security when you collect. Good question.
Great. Thank
They're all
you.
good questions.
They are. All right, and I think that is all we had. So again, thank you all for logging on and watching this live. If you're watching this on YouTube, be sure to check out some of our other programs as well. We have a lot of financial resources on our Digital Resource Center, so be sure to check that out. Again, that link is www.dana-farber.org/resource center. And you can keep track of all of these webinars on our YouTube playlist and the Digital Resource Center. So thank you again, everybody, and have a great day.
Thanks.